Hello, I'm Dr. Janet Rueger. I'm a chiropractor practicing in Ashland, Oregon. I also have been using cranial adjusting with patients for over 40 years. And I got into studying cranial work from my own health issues. As a teenager, 4 bicuspid teeth, these are the ones here, were extracted on me. Shortly after that, I developed some health issues, which at the time I did not know were related to having those teeth extracted, but now I suspect that they were. I've had my own health issues over the years, and that has caused me to learn more about cranial work and the need for chiropractors who do cranial work to also work with dentists who do expansion of the jaw. Over the years, I've had trouble finding many dentists who did jaw expansion, or if they did, it didn't seem to work all that well. I began with an expansion device on myself in 2006. I had an appliance called an ALF, and that helped a little bit, but it really didn't make a significant difference with me. Then I found a dentist in Ashland who was working with an appliance called the Mago. His explanation to me was that this would be wonderful for me and expand my jaw. It did not do that at all. It was a total waste of my time and money. Then I found another dentist who had an interesting approach, but she left the area. And then I drove 3 hours to see a dentist up north of Eugene, Oregon, who used the Crozat, and that did expand me out and help me considerably. But what it did not do is it did not bring me forward. It only brought me this way. So I felt it helped me, but not enough. At that time, Dr. Tanner, who I've since met, was not in our area. Now that he is here, I am delighted that he is addressing both the width of the jaw and the need for forward expansion. And I am going to begin treatment myself with him because my airway is narrower than it should be. I have a slight amount of sleep apnea, and I have seen that corrected with the work that Dr. Tanner does with his appliances in conjunction with cranial work and working with the neck positioning. Many people have this forward neck posture like this, especially with being on their phones, and we need to bring our jaw down and our neck back like that. That helps to open up the airway. So as a chiropractor, I'm working with people on not only adjusting their neck, but giving them exercises and awareness of their posture. And then also doing some very gentle cranial work. And then there's one technique I do when it's appropriate and needed that's quite, I guess it's a little invasive. We take a little tiny balloon and insert it up gently into the nose, and then we use what's called a sphygmomanometer, a little bulb like is used in taking blood pressure the old-fashioned way. We blow that balloon up inside the nasal cavity, and there are 3 openings on each side, and we choose based on our exam which opening to open first. And often the first visit we only do 2 openings. Sometimes we'll do 3 the first visit, and we usually do this treatment over a series of a few weeks. And the thing that people most often tell me after the very first session with that is, I can breathe. They just say, wow, I can breathe like I haven't been able to breathe in 20 years. I've heard so many times. And that just opens my heart to have people realize that just this relatively simple procedure, although it takes very specific training to do it. Don't ever let anybody do that who's not properly trained and certified in it. It's just so wonderful to have people's breathing improved. And doing that in conjunction with the jaw expansion when that's needed has changed many people's lives tremendously. If we don't get enough air in, our brain doesn't work properly and our heart doesn't work properly. And over the years, I've seen people with heart problems that I am sure are due to airway obstruction. And I've seen people with their cognition, their thinking not being good, and I feel that that's being due to a lack of air supply to their brain. So, and then sometimes there are even little children who need expansion, a lot of them these days, and Dr. Tanner works with those children wonderfully. I have my own 2 grandchildren doing jaw expansion there. They live back in Texas, that they found a dentist there who's been doing jaw expansion with them, and I can see the improvement in them. As a chiropractor, I see that they look healthier to me from a chiropractic perspective. So I am thrilled that Dr. Tanner is doing this work, and very grateful that I'm able to have it done for myself also.